Biomedic's non-invasive arterial testing technology is designed to detect peripheral artery disease in a variety of frontline care settings. Keeping educational materials in the waiting room is a great way to encourage patients to start a conversation about any symptoms they may be experiencing. While in the waiting room, patients can complete a brief patient questionnaire that is supplied with the testing system. The physician can review this questionnaire along with the patient's background and risk factors and order non-invasive testing if indicated. Only those patients whose history and physical examination results show appropriate symptoms that indicate medical need for the test should be tested. Be sure to ask the patient if they have any condition that would prevent you from taking a blood pressure measurement on their arms or legs. When a PAD exam is scheduled, it is important to let the patient know that they shouldn't smoke for 30 minutes prior to this appointment. Because pressure cuffs need to be applied directly to bare limbs, the patient should also be informed to bring their own clothing that is suitable for the test, such as a t-shirt and shorts that are not constricting. When the appointment has been confirmed, you may wish to enter any available demographic information ahead of time. The test takes about 15 to 20 minutes. For beginners and those who are new to the system, plan to set aside some extra time for testing. This is a user-friendly baseline test. As you become more familiar with the testing procedure, you can shorten the time you need to complete the test. When the patient has changed into appropriate clothing and is ready for the exam, they should rest for 5 minutes in a comfortable position. For the exam, the patient should lie so that the ankles are level with the heart. Apply all of the cuffs bilaterally before starting the test. For the complete arterial test, you will need to apply the ankle cuffs, calf cuffs, above knee cuffs, and arm cuffs, and you may optionally apply the digit cuff to the toe. Only the appropriately labeled cuff should be used on the corresponding extremity location. It is important to maintain consistent cuff placement and tightness. If one or more fingers easily fit between the cuff and the skin, the cuff is too loose. The entire cuff should be touching the skin in most circumstances. The digit cuff on the toe is an exception to this rule, as it should be placed more loosely against the base of the toe. All tubes attached to the cuff should be visible on top of the patient's extremity, never underneath. Place the photoplethysmography or PPG probe on a finger on the patient's right hand. You will move the probe down to the toes after arm pressure testing is complete. To begin testing, click Perform New PAD Test. Document required demographic information. Remember to enter the patient's insurance, name of the referring physician, and the physical signs and symptoms. Click the Test tab, then click Perform to begin the test. Follow on-screen instructions for tubing connections and zeroing if necessary. You will start from the arterial test summary screen. The first testing location is the right arm. Click inside the right brachial box on the test screen to begin testing. Connect the hose to the arterial occlusion cuff port on the front of the device. Then, connect the other end of the hose to the right arm cuff. Click the Start button on the screen or press 1 on the laptop keyboard. For arm pressures, the system will first display a reading from the PPG probe on the right finger and ask you to confirm a pulse. If you do not have a PPG probe, you may skip the affected portions of this test. Upon confirmation, the system will record the pressure for this location using air cuff technology. During the exam, ask the patient to lie still and keep conversation to a minimum. Test measurements that have been affected by patient movement are usually not acceptable to send for interpretation. After pressure has been released from the arm cuff, select and confirm the return of flow as detected by the PPG probe. This measurement provides additional information to support pressure accuracy. Click Save or press 2 on the keyboard to continue. As an alternative to the user-friendly air cuff process for recording pressures, the system is Doppler-enabled. This allows pressure measurement and recording with an external Doppler. Use a USB-connected foot pedal or other device to mark the return of flow as the system inflates the cuffs. When using Doppler, mean and diastolic readings are not available. When Doppler pressures have been enabled within the software settings, you must use this alternative pressure process at each location. Use the same pressure procedure to complete pressures testing at the left arm. The software will automatically advance to the next anatomical location as the test progresses. Test alternating sides to allow each limb resting time between cuff inflations. Move on to pulse volume recordings or PVRs down the lower limb segments. Remember to move the probe from the finger to the toe of the limb being tested. Connect the hose to the right above knee cuff and click the Start button on the screen or press 1 on the laptop keyboard. The software will generate waveforms that flow across the screen. After you have produced a full screen of quality waveforms, click the Stop button or press 1 on the keyboard. To record the amplitude, click on the lowest point, then highest point of one wave. The amplitude will display on the bottom left PVR amplitude box. The software will guide you to complete the PVR process for each required anatomical site. Complete the left above knee PVR using the same process, and then connect the hose to the right calf cuff. Repeat the PVR process for the right calf and save your results. Complete PVR testing at the left calf and the right ankle. At the left ankle, you will complete a PVR and then a pressure measurement. To complete pressures at the ankle level, repeat the process used to record arm pressures. The system will prompt you to identify the return of flow as indicated by the PPG probe on the toe. Click on the waveform to mark the return of flow and then click Done. If you completed arm pressures for the ankle brachial index using the Doppler-enabled method, the software will prompt you to complete all other pressures using this method. This ensures clinical consistency when comparing pressures and calculating ABI or TBI. While Biomedics recommends a foot pedal to mark the return of flow, you may choose to use an alternative USB-connected device. If you are not completing additional segmental pressures, toe pressures, or PVRs, arterial testing is complete. To record segmental pressures, which can help further localize disease to specific segments, the test will travel back up the legs starting at the left calf. Pressure testing at these additional segments will follow the same procedure as the left and right ankle locations. At each location, secure the hose connector to the appropriate cuff. Click Start on the screen or press 1 on the keyboard. Wait for the cuff to inflate and deflate and then mark the return of flow. Upon completing pressures at the left and right above knee locations, you have finished segmental pressure testing. If the patient has non-compressible vessels at the ankle level, you may wish to also complete toe pressures and PVRs. Starting at the right toe, follow the same pressure taking and PVR procedures you use for the ankles. Then, repeat the process at the left toe. are not conducting post-exercise testing during this exam, the test is complete. Post-exercise testing can help unmask peripheral artery disease in patients whose symptoms are not explained by the resting exam. For example, those suffering from claudication but have had normal at-rest results. Click the Post-Exercise Test button on the test summary screen. Remove the above knee and calf cuffs, leaving the ankle and arm cuffs on. Then, have the patient walk on a motorized treadmill until the onset of symptoms, or up to 5 minutes. In the Notes section, record the specifics of exercise, including the time, speed, and incline of the treadmill. When exercise is complete, click the Stop and then Save buttons on your screen. Properly position the patient on the exam table as you did for the resting exam. The software will prompt you to record the pressure of the arm that had the highest at-rest pressure. Click Start. The system will record and display the pressure. Click Save or press 2 on the keyboard, then repeat at the right and left ankle locations. After ankle pressures are complete, record PVRs for both ankles. Follow the PVR procedure used during the resting study to measure amplitude and save. Continue performing and recording follow-up pressures every 2 minutes for 10 minutes. If leg pressures return to the pre-exercise level before 10 minutes, click Exit. The post-exercise test is now complete. After the test is complete and you have exited the test summary screen, select a read site and click the Test Sign box on the Test tab. You are now ready to send the test to a specialist interpreter or reader via the seamless Biomedics Collaborative Care Network. From the home screen, click Send Receive Tests. Click Send Sign Tests. The test has now been sent to a reader and will be returned soon. The reader will look for indications of disease and provide an expert interpretation of the test. If you have remote view access, you can check the status of the study and create other valuable reports from any internet connection. To retrieve interpreted tests, click Send Receive Test from the home screen. Click Get Score Tests, then click Interpreted to display all interpreted studies. You can print the test by clicking the Report tab. Check the desired items and then click Print to send the document to a printer or PDF creator.